Morbidity measurement. Incidence is defined as the number of new cases occurring in a defined population during a specified period of time. For a given period, incidence number of new cases of a disease in a year. Total population rates per thousand. Incident rate is a rate expressed per 100. Special type of incident rate. Attack rate. Incident rate used when population is exposed for a small interval of time. Example, epidemic. Secondary attack rate. Number of exposed person developing the disease within the range of incubation period following exposure to the primary cases. Incident is the best measure of disease frequency in a etiological study. Incident can be determined from cohort study. Prevalence is a total current old plus new cases in a given population over a point or period of time. Type of prevalence or point prevalence, point of time, period prevalence, period of time. Prevalence number of total new plus old cases of a disease in a year divided by total population per 100. Prevalence is a proportion. Prevalence is not a ratio. Numerator is a part of denominator and is always expressed as a percentage. Prevalence can be determined from cross-section study. Relationship between incidence and prevalence given the assumption that population is stable and incidence and duration are unchanging. Prevalence is equal to incidence into mean duration of disease. Prevalence is equal to incidence into duration. Prevalence describe balance between incident, mortality and recovery. Incident reflect the causal factor. Duration reflect the prognostic factor. Association and causation. Hill's charge in general criteria of causal association. Temporal association implies cause precede effect or effect follow cause. Consider both order of appearance as well as length of interval between exposure and disease. Most important criteria of causal association best established by cohort study, especially concurrent cohort study. Strength of association, relative risk cohort study, odds ratio, case control study. Specificity of association implies that disease under study is caused only by risk factor under study. Is most difficult criteria to establish. Weakest criteria of causal association. Consistency of association implies that results are replicable in different setting and by different method. Biological plausibility implies existence of biological credibility of association. Anatomically, physiologically explainable, justifiable. Coherence of association implies that the causal association must be coherent, supported by with relevant fact or related study. Dose response relationship implies that increase in dose of the cause increase the incidence prevalence of effect. Causation of exposure reversibility imply that removal of possible cause reduce the risk of disease. Study design imply that if the study design is based on a strong study design. Epidemiology of infectious diseases. A definition: infectivity, number of infected divided by number exposed. Pathogenicity, number of disease divided by number of infected. Prevalence, number of serious condition, and mortality by number of disease. Case fatality, number of death divided by number of case. Communicability, ability of disease to spread from infective to susceptible host. Zoonosis, an infection or infectious disease transmissible under natural condition from vertebrate animal to man. Classification of zoonosis based on direction of transmission. Anthropozoonosis, infection transmitted from animal due to man. Example, rabies, plague, anthrax, hydatid disease. Trichinosis, zooanthroposis, infection transmitted from man anthro to animal zoo. For example, human TB in cattle. Amphizoonosis, infection transmitted in either direction between animal and man. Example, Trypanosoma cruzi, Schistosoma japonicum. Classification of zoonosis based on life cycle of infecting organism. Direct zoonosis transmitted from infected to susceptible vertebrate caused by direct contact formite vector. Example, rabies, brucellosis, trichinosis. Cyclozoonosis involve more than one vertebrate species. Is by example, teniasis, echinococcosis. Metazoonosis transmitted biologically by invertebrate vector. Example, plague, schistosomiasis. Herboviral infection. Sparrowzoonosis involve non-animal development site or reservoir. Example, mycosis larva, migraine. Related terminology: reverse zoonosis is synonym with zooanthropognosis. Epizoonotic outbreak, epidemic of disease in animal population. Example, anthrax, brucellosis, influenza, rabies, Rift Valley fever, Q fever, Japanese encephalitis, equine encephalitis. In zoonotic, endemic of disease occurring in animal. Example, anthrax, rabies, brucellosis, bovine TB. Endemic, typhus, tick typhus. Epornithic outbreak, epidemic of a disease in bird bird population. Endemic refer to the usual or expected frequency of disease within a population group, is the constant presence of disease in a defined geographical area. Hyperendemic, when a disease is constantly present at a high incidence or prevalence state and affect all age group. Holoendemic, when a disease has a high level of infection beginning early in life and affect most of children population. So disease is more common among the children than adult. For the disease to be in an endemic steady state, R0 into S is equal to N, where R0 plus basic reproduction number of an infection. The mean number of secondary cases or typical single infected cases will cause in a population with no immunity and in absence of intervention. S is equal to proportion of susceptible in population. Endemic curve is drawn between number of cases due to disease and the time. Endemic curve is not a straight line. Its number of cases for the endemic disease in a population will not be fixed throughout the year. It will show a seasonal or other variation. Endemic curve versus epidemic curve. In endemic curve, the baseline of the curve never touches zero. When the disease occurs clearly in excess of normal expectancy, it becomes an epidemic. Epidemic of or relating to disease that originate outside the geographical area in which it occurs. Okay. Disease transmission definition. Incubation period is a time interval between invasion by an infectious agent and appearance of first sign or symptom of disease in cohesion. Median incubation period is the time required for 50% of cases to occur. Generation time is the time taken for a person from recipient of infection to develop maximum infectivity, is roughly equal to the incubation period of disease. Latent period is the period from disease initiation to disease detection used in non-infectious disease. Its equivalent of incubation period. Serial interval is the gap in onset between primary case, first case in the community, and secondary case developing through infection from the primary cases. By collecting information on series of secondary cases with serial interval, one can gauge the incubation period of disease. Period of communicability is the time during which an infectious agent may be transferred directly indirectly from an infected person to another person, from infected animal to man, or directly indirectly from an infected person to another person, from infected animal to or from an infected person to animal, including arthropod. An important measure of communicability is secondary attack rate. Incubation period depends upon generation time of a pathogen, infective dose, portal of entry, individual susceptibility. Incubation period of disease is useful for tracing the source of infection and contact, determining the period of surveillance, applying immunization principle for prevention of diseases, identification of point source or propagated epidemic, estimating prognosis of a disease. Attack rate relate to number of cases in the population at risk, reflect extent of epidemic, is used when population is exposed to risks for a limited period of time, such as epidemic. Attack rate, number of new cases of specified disease in a specified time interval, total population at risk during the same time interval into 100. Secondary attack rate is the number of exposed person developing the disease within the range of incubation period following exposure to primary case. Secondary attack rate, number of exposed person developing disease within the range of incubation period divided by total number of exposed or susceptible contact into 100. Denominator include only those susceptible in close contact. Primary case is always excluded both from numerator and denominator for secondary attack rate calculation. Secondary attack rate of few diseases. Secondary attack rate: smallpox 30 to 45, measles more than 80%, chickenpox more than 90%, mumps 86%, pertussis 90%. Source is a person, animal, object, or substance from which an infectious agent passes or is disseminated to the host. Source refer to immediate source of infection and may or may not be part of reservoir. Reservoir is any person, animal, or arthropod, that plant, soil, or substance, or combination of these, in which an infectious agent lives and multiply, on which it primarily depends for survival. Human reservoir cases: person having particular disease, health status, or condition under investigation. Carrier: infected person or animal that harbor a specific agent in the absence of discernible clinical disease or and serve as potential source of infection for other. Carrier are less infectious than cases but are more dangerous epidemiologically. Animal reservoir example rabies, influenza, yellow fever, histoplasmosis. Reservoir in non-living things example soil harbor agent for tetanus, anthrax, coccidioidomycosis, mycectoma infection. Sources reservoir hukum भनेको soil man, tetanus soil, typhoid fish, urine, food, milk, water चाहिँ sources भयो भने reservoir चाहिँ cases अथवा carrier भयो. Cases a person having a particular disease, health disorder or condition under investigation. Clinical cases mild, moderate, severe or fatal. Subclinical cases inapparent, covert, missed or abortive. Latent infection, host does not save the infectious agent which lies dormant in host without symptom. Example Horrific simplex, Bill genes or disease, acyclostomasis. Cases in epidemiology. Primary cases, first cases of communicable disease introduced into the population unit being studied. Secondary cases, cases that develop from contact with the primary cases. Index case, first case that come to the notice of the investigator. First case reported to health system is an index case for you. Carrier, infected person or animal that harbor a specific agent in the absence of discernible visible clinical disease or serve as a potential source of infection for other. Carrier are less infectious than cases but are more dangerous epidemiologically. Carrier by type, incubatory carrier said infectious agent during the incubation period of disease. Example measles, mumps, polio, pertussis, influenza, diphtheria and hepatitis B. Convulsion carrier said the disease agent during the period of convulsions such as typhoid, bacillary dysentery and pertussis. Clinical recovery does not coincide with bacteriological recovery. Healthy carrier emerge from subclinical cases without suffering from overt disease. Example poliomyelitis, cholera, meningococcal meningitis, diphtheria and salmonellosis. Carrier by duration, temporary carrier said infectious agent for a short period of time. Example incubatory carrier, convulsion carrier, healthy carrier. Chronic carrier excrete infectious agent for defined period. Example typhoid, hepatitis B, dysentery, meningococcal meningitis, malaria, gonorrhea, etc. Carrier by portal of exit, urinary carrier typhoid, intestinal carrier typhoid, cholera, amoebiasis. Nasal carrier diphtheria, staphylococcal food poisoning. Respiratory carrier, nasopharyngeal carriers are meningococcus